Discovery Health Channel. Real stories of human triumph. The leading edge in high-tech medicine, fitness, and information you can trust for a healthier life. Discovery Health Channel, a new 24-hour TV channel and website devoted to what's most important, your health. Discovery Health Channel and online at discovery.com/health.
Not too long ago, being diagnosed with cancer was almost like getting a death sentence. But today, there are more cancer survivors than fatalities. And oncology nurses are there to provide the critical human connection between the latest high-tech therapies and a very old disease. Early morning at Johns Hopkins Hospital in Baltimore, Maryland. The 7 a.m. nurses shift is arriving for work, hoping none of their patients has taken a turn for the worse during the night.
Everyone on the floor is pretty stable right now, so it's one of those happy times when I can come in and know it's going to be a great day and good things will happen instead of wondering who's going to crump on my shift.
Melanie Michelle is an oncology nurse who works with bone marrow transplant patients in the ward known as 3 South. After studying philosophy in college, she went through 2 years of nursing school. Now, the 32-year-old Texan is working on a double master's degree in public health and oncology, but few people understand the nature of her job or the amount of training it requires.
First of all, when I say I'm a nurse, I think a lot of people think, oh, geez, there's someone who empties bedpans and gives shots. And then when I say I'm an oncology nurse, people say, ooh, oncology. I really don't want to hear anything about that. So unless someone is really interested, I say I'm a nurse and leave it at that.
In the nurses' station, the night shift fills in the day shift on how their patients spent the night. This is the time when crucial information is exchanged, all the details of the treatment that keeps patients alive.
So this afternoon,
I'll be FK to PL, so she needs a level 1 chronic.
It's a light day. I've only got 2 patients, which is nice. They try to keep staffing to patient ratio low. We're a critical care unit, and the patients are actually a lot sicker than they actually look.
Most of the patients Melanie works with have leukemia. Their bone marrow is producing malignant blood cells. They haven't responded to conventional treatment, and this may be their last resort, a bone marrow transplant. First, powerful drugs and radiation destroy their defective marrow. They are left without any platelets or white blood cells. Defenseless against infection, a common cold could kill them. But this might save them. A quart or so of healthy bone marrow from a donor. Like many patients, Jack Hooks came to Hopkins after all other attempts to cure him had failed. The donor's marrow enters Jack's bloodstream through a tube in his chest. From here, it will find its way into the bones, where it should begin producing healthy platelets and white blood cells. Jack will be away from his home for at least 2 months. Today is day 13 after transplant for Jack.
Hello, we're all here.
You're my nurse today, hey?
You lucky devil.
Sorry about you again.
Melanie monitors Jack's blood counts. a key indicator of how the treatment is working.
Do you mind if I draw a little bit of blood?
I like that nurse talk stuff you do.
Yeah, you like that?
She must also keep a close eye on his symptoms to catch the first sign of a life-threatening infection.
Invented by a physician in Washington
You know,
State.
when they tell you percentages, you think, well,
This man should be awarded some sort
3 out of
prize
10 you
because
could
of all the
die.
pain
You know,
and
you got a
grief.
30%
One purple
chance.
top.
God. Is this one tube? You already drew another one.
Yeah, the syringe.
One night,
I know you. Can
a lady had just died up the hallway, and there was 2 other people that didn't make it before I got out, and I was counting rooms and counting the odds of me.
And Trish will be by.
It scares you.
around.
It scares you bad, and your whole life changes, and you can't go back to what it was. Next thing you know, they're talking to me like they've known me all my life.
I think you make an impact on the people you meet. So.
Jack has actually had a very smooth course, which you never take for granted because you see too many things that go wrong. I go into each new relationship with a patient knowing I want to be the best nurse I can be for this person and be as close as I can be and constantly affirm our human bond. But at the same time, if this person dies, I need to come back here and do the same work over and over. I think you need to have a line that you don't cross for your own sanity and emotional stability.
The viral.
Over the last few decades, the traditional image of a nurse, someone who wears a uniform and works in a hospital, has undergone a profound change. Like Melanie, Stephanie Mayer has an undergraduate degree in the liberal arts, followed by 6 years of nursing school. Today, she works as a hospice nurse, caring for people who have chosen to die outside the confines of a hospital. Her job is part pain management, part family therapist.
The first time I walked into somebody's house, I just fell in love with this job. Just love it. How are you? I feel more of a nurse now than I ever did in the hospital.
Louise Rees is 69 years old, and she's dying of lung cancer.
Excuse me, I'm gonna wash my hands. Her disease is incredibly invasive. It's very rapid. I wouldn't expect her to make it a month.
Her son Bobby has moved home to take care of her.
She chose no further treatment and hospice care. So this is something that she's just resolving. Is this no more treatment?
Miller?
That's a big thing.
You're wearing a Miller t-shirt?
Sometimes I wonder if I'd get chemotherapy till I drew my last breath. It's a tough call.
Hurt when I press?
There's always a chance that maybe it'll work.
All day yesterday, I didn't want nothing to eat. I figured what I could find out there to eat. And then I ain't got the energy to fix it if he ain't here. I ain't got the energy
That's
to fix it.
why we want to get you some Meals on Wheels.
Yeah,
You need to let Terry come.
Yeah,
Louise, to be honest with you, I don't care if you don't eat.
yeah.
I don't. I know
Thank
cancer
you.
makes you lose weight.
Yeah, yeah.
I know cancer makes you not want to eat. You
Yeah.
don't want to eat, don't eat.
Isn't she nice? She's the best I've seen. She ain't like a nurse or nothing. She's just like being a friend or something. Yep.
You are a pleasure to come see.
Thank you. You're a pleasure to have here.
I really love
You people too. I'm glad you people are here too.
Is there anything you haven't told me?
Nothing. I ain't had no dates, no boyfriend, nobody sneaking in.
First time I met her, I knew that this was somebody I could joke with. When the first words, I say, "Hi, my name is Stephanie, how you feel today?" And she says to me, straight-faced, little old lady, cute as a bug's ear, lying in the bed, oxygen on, looking kind of peaked, not taking her medicines correctly. She says, "I haven't had sex in 11 years, can you help me?"
I did that to Dr. Patrella.
And I'm like, "No, well, I could give you a magazine. Maybe you could order something."
She's very hard for me to determine whether or not she is hiding behind humor and using it as a defense mechanism.
If I know the street has got cars in it, am I going to go lay in it?
No.
So I'm going to try to get her, I wanted to get her to focus more on leaving Bobby, and that is my goal.
I'm impressed. I'd keep her.
There might be something she hasn't said yet to Bobby that she might need to say. That's what I'm gonna shoot for.
All my life I've been taking care of Mom, literally, you know, making sure she's okay. Whenever I ever left her, never made sure you were okay.
But not living with
But no, pretty much I've been like pretty close since this has happened. We went into the hospital, found out what was what. I think I've been on the train ever since with her, you know.
You take care of that back. Ibuprofen if you need it.
Bobby is going to do great. He's gonna do great. He's doing little things. He's buying her flowers. He's buying her things to cheer her up. So I think Bobby's gonna do good.
Ugly head on Elwood.
you Tuesday.
See ya.
Lily Shockney is another nurse who defies the conventional image. For nearly a decade, she's devoted her life to a mission, revolutionizing the way we treat women with breast cancer.
Patients may call the General Hopkins line, and if they're crying and they say they've got breast cancer, the operators know to connect them to me. End up wearing your bra, I tell people.
Lily knows exactly what patients are going through. 8 years ago, she went through it herself and was shocked by the experience. Something vital was missing in the care available to breast cancer patients, and she had the power to provide it.
It's good to see you, sweetie. Either side. But I think that I became personally touched with this disease because of the fact that I would be given an opportunity later to combine my clinical nursing skills with my personal experience with breast cancer and put those two together to help other women that end up wearing my bra. What a blessing that is. What a very unique opportunity I have. I'm going to be going to see Kirsten Pickle, who's come here being a newly diagnosed woman with breast cancer, and she's quite young. She's only 31.
Full-time? Yes. Last Monday is the first day I found out that I had cancer, so it's just been a week that I've known that I've had cancer. I've got really a great life right now. I'm so happy, and I just want to live, and I've had just these panics of, my God, I just started really living and I don't want it to end.
I feel that my mission is to help reduce the emotional and physical trauma that a diagnosis and treatment of breast cancer has on women.
Oh, good to meet you.
Lily is tireless in spreading the word about the programs she's developed, and a growing number of hospitals around the country are using her innovations as a model. One of Lily's contributions has been to come up with ways to prepare women for the shock of a radically changed body.
This is a mastectomy without reconstruction. It's a perfectly straight line across her chest. Well, we're going to look at several of these, and I'll show you which one I would suspect for your body size that you would match up with. This woman, being smooth, flat chest, would pretty much be the way that you would look like you're 10 again on one side.
Now, people who just do these mastectomies without reconstruction, are they really happy with that, or?
Yes, they are. I being one of them. A key factor for me is that 80% of women who undergo mastectomies have phantom limb sensation. So my brain says my breasts are still there. My brain does not know that they're gone. And I like that. I like that feeling. I also had my husband practice to find my phantom breasts. And he knows exactly where to touch along my chest wall to simulate touching me out here. So I make him practice.
So if you have reconstruction, you can't have the phantom?
The phantom limb goes away with reconstruction. And it's because currently those nerve endings are still in my incision. With the breast reconstruction, they're taken away surgically and replaced with either abdominal tissue or with an implant. Tell me what your reaction's been with all of this.
So far, I'm just like, I have cancer, get rid of it. You know, I'm not even thinking about these pictures until you showed them to me. And I'm like, oh, okay, maybe that'll be the after effect. But yeah, I just want to live. So.
Finding out that you have cancer doesn't have the same grim meaning that it used to have, as Norman Bage recently found out.
I found a tumor in my right testes and went to see a urologist after getting over the initial 2-week fear of, please let it not be what I think it is.
So how old is the baby?
Norm is getting his last chemotherapy treatment for an illness most men don't even want to think about.
I mean, my God, it's testicular cancer. It's not even easy for me to talk about, but I've kind of come to terms with it and said, look, it was cancer, it was poison, I didn't need it.
The 5-year survival rate for testicular cancer is high, over 90%, if it is detected in time. But many men are reluctant to see a doctor.
We'll take
that fear of getting a treatment that could save your life, it's just, you have to be stronger than that, in my opinion.
Sound good?
Okay.
I don't hear anything.
Okay. It's a pride issue and a manhood issue, and you know, will I be the same? And I am. I had him after my surgery.
We had donated sperm into a sperm bank in case, but now we kind of find out that we don't need it.
Most precious thing in my life. We got healthy babies, right? Bye. Generally, men 16 to 35 are the most susceptible to testicular cancer. And a self-examination in the shower once a month could really save your life. We're celebrating tonight and for weeks to come.
Back at 3 South, Melanie is bringing medicine to Liz Dow, another bone marrow transplant patient.
Food and fat and tobramycin and all sorts of stuff. All right, actually, I'm gonna
nutrients for the day.
This is just one of the many visits she'll make to Liz's room today, and she looks forward to the time they spend together.
If you wouldn't mind, I'd like to listen to your lungs.
Oh, no.
It's nice, you know, the intensity of our encounters, the frequency. You don't spend every day with someone for 3-4 weeks and not get to know them, not have them be a little piece of your life.
You guys. Really? Don't. They come in and see you for... If I'm depressed, they know. It was my birthday, one of the days that I was in here. And those little stinkers, they brought in a little birthday cake for me. And I cried because it was just touched me. So they remembered that it was my birthday.
That's fine. Thank you, though. Are you feeling chilly at all?
I was earlier, but I turned the heat up and...
That got rid of it?
Yeah.
2 years ago, Liz was diagnosed with an especially aggressive form of leukemia and told that she had less than a 1 in 3 chance of surviving the treatment.
It wasn't a big blow. It really wasn't. I'm a firm believer in God, and it's brought me a lot closer to God. It's brought me a lot closer to my family. It's made me realize what's really important in life.
That does sound better.
Does it sound better?
Nice.
I mean, so many days you just don't realize that all this is really irrelevant unless you appreciate it. So it's made me appreciate quite a bit.
All right, lady, I think you're good to go.
All right.
We've got your dinner set up. We've got the
The time Melanie spends with her patients is rewarding for her as well.
You made a good lasagna
Yes,
last
I
night.
did, and
I think of myself sometimes as a zealot. I love this job. I'm so grateful to be doing this work. This work enhances my life, and because it gives me a window into what's important and what's real and what's meaningful.
Platelets are 22, your white count is 510, and your...
What is it? That's great.
Is that great?
That's great.
Being here, getting treatment for a life-threatening disease, it boils it all down to the core issues. The little things don't matter.
Nothing's happening there.
All right, let's see what it's doing in here. Hey, this is looking better.
It's been 2 weeks since Jack Hooks got his transplant, and he's showing signs that the treatment is working.
So I'm looking forward to a future with my fiance more than anything. I met her right about the time I found out I had this. I offered her a chance to get out at that time because it didn't look very bright at the time. And she's a very special lady in my life, and that's worth the will to live.
Come in between there so I wouldn't have to be up with for you and then with Steph.
For a hospice nurse like Stephanie Mayer, knowing that none of her patients is likely to live more than a month or two goes with the territory. Her job is to help people die well, at peace with themselves and their families.
Again.
Stephanie sees up to 4 patients a day, staying as long as she's needed.
One more time.
Don't say it's good, I can hear it.
She monitors the signs a body makes as it's winding down and keeps her patients informed about their condition.
I got a death collar. That's great.
Got a what?
What you call a death collar. That's what I used to tell my sister.
You're not got a death collar yet, for Pete's sake.
Well, I'm gonna get it when you see it. You'll get jealous and try to wear my makeup.
I'll tell you when you're gonna die, okay?
Okay, you better too, boy.
I'll say, Louise, it's time to make your peace.
Stephanie works to make her patients as comfortable as possible.
No, you've got time.
Good.
She treats their pain first and then tries to address the fears that arise about leaving loved ones behind.
The only thing I worry about is pain.
And she never knows how much time she has to get the job done.
I go to bed at night and I might be just laying there and it'll be something I spot. All right, like the pictures of my daughter and him when they were babies. See him on the wall. And goofy things he's done. Man, just anything like that. That's what I said, I'm not scared of dying. Because I know God's with me, but it's leaving that goofball there.
As the days pass, the talk often turns to tensions in the family.
But it's like I said, they're jealous. You don't believe my
Wanda
sister
and Bobby.
They don't get along.
How long have they not gotten along?
What I think she's jealous of Bobby being. Bobby's always been there for me.
Did you have a fight?
No.
Her way, I went my way.
Why? I think if she won't give me any money, she's afraid I'll give it to him.
Probably the most important part of hospice care is family dynamics. Because the family is the primary care provider. I come in, I do my thing, and I leave. And I have to feel safe and comfortable that the family is going to be able to take care of this patient.
How old are you?
39.
How old is she? You can smoke as much as you want. It's not going to make a bit of difference.
Yeah, I know.
You're still going to cough the same.
Was there a fight?
I'm just worried about your safety.
Was Louise involved in it? There's some hurt feelings somewhere in that house. And I think it would be helpful to both of them if we could talk about it.
My car's going to work. Call me if you need me.
I will,
She's unveiling.
Back at the Johns Hopkins Breast Center, Kirsten Pickle is meeting with Dr. William Dooley, the oncologist who will perform the surgery.
How are you? Do we have your microscope slides by any chance?
Yes.
Okay, good. All right. That's fine.
Lily is there for emotional support and to help Kirsten and her husband Bruce sort through all the information Dr. Dooley is presenting.
We can always switch gears over to mastectomy. What we don't know is the extent of what we found.
Kirsten has ductal carcinoma in situ, a form of cancer that is for the moment confined to the milk ducts.
That ability, it can burrow into things like blood vessels, lymphatics, and particularly get it someplace else in the body. That's when it becomes an invasive cancer.
Often, this type of cancer can be treated with lumpectomy, and much of the breast can be saved. But unfortunately, Kirsten's cancer is located directly behind the nipple.
A bigger excision is going to lose tissue, probably including the nipple, which means, is the loss of a nipple and some central top of the cone, you know, flattening the cone off here, going to be so much cosmetically you're not interested in it, even though it's only, you know, small lime-sized piece of tissue.
What you just said was my options were doing the lumpectomy, but because it's where it's located, that's going to be a lot of...
It means, you know, when you saw the pictures, you saw a lady who had breast conservation who had lost her nipple.
Was gone.
Oh, right.
One that uses a shoulder pad to fill it in.
A lumpectomy, an attempted lumpectomy in you is going to do that.
And I need radiation with even that surgery.
With lumpectomy, but not with mastectomy.
Okay.
With lumpectomy, but not mastectomy.
But the radiation has a whole nother set of
There's a lot of symbolism associated with the nipple, and that oftentimes for women that are going to be embarking on breast-conserving surgery, if they have to sacrifice their nipple, then they say, well, then there's no marginal benefit in me keeping this breast if I'm going to lose the nipple. It's very disappointing that you would have to lose the nipple in either situation, lumpectomy or mastectomy. That is very disappointing, absolutely. Because usually what drives lumpectomy is, good, I get to save my nipple.
Right.
But
Kirsten is leaning toward having a mastectomy and wondering whether she should have her other breast removed as well.
Overwhelming information.
It's a difficult decision, weighing the fear of cancer against the loss of a healthy breast.
That's why. But you would be able to get the branches even with the lumpectomy.
Morning rounds on 3 South. The medical staff is becoming concerned that Liz Dow's bone marrow transplant isn't working.
Liz is compromised at this point. She has 0 white counts, so she's extremely susceptible to infection. She's on a slew of prophylactic antibiotics, but giving her an external protection that way is not going to be as effective as a functioning immune system. And then having a 0 platelet count is just doubly worrisome.
How's the throat?
Throat is not too bad. Swallowing is getting better. Of course, I'm losing my voice. My greatest hope is that the cells engraft, meaning that they attach themselves inside my bone marrow and they start producing the healthy cells.
And that is a concern that, you know, we're not getting you to bump, but we have different ways
That's my biggest hope, and that's my biggest prayer.
One thing we did do was start you on the Amicar.
Liz herself suggests the possibility that platelets from someone related to her may work better than the ones she has been getting.
One of my family members donating platelets.
It's not uncommon for patients who aren't responding to treatment to look for alternative solutions.
To have a pool of platelet donors that they count on.
Right, since I'm resistant to the pool of platelets. They do sometimes. Well, I was just thinking that because me and my sister have the same blood type, but it's just something that I thought, hey, well, maybe if she's got platelets that are same as mine, then we could try it. That's me thinking, you know.
While Liz waits and hopes her condition will improve, Jack Hooks is preparing to leave the hospital. He'll be spending the next few weeks at a nearby apartment, making daily visits to the hospital and waiting for his immune system to recover enough for him to go back home to Ohio.
It's just so dry. 4 weeks of sitting in there and laying in there. You go in there and you feel like you might not come out. I guess I'm one of the lucky ones. It gives you a lot of time for soul searching. And then there's a lot of things about me I'd like to do differently, and I feel like I got a new life. I feel like I have 2 birthdays now. I thought May 2nd is when I got my bone marrow, and if it hadn't been for that, I probably would die.
Cancer is a strange bedfellow. The initial diagnosis can be terrifying, but patients often find they've received an unexpected gift. a deeper appreciation of life.
Thank you.
Lily Shockney responds to an average of 60 phone calls and 100 emails each day. Her pioneering efforts have transformed the way breast cancer patients are treated at Hopkins.
Lily Shockney, may I help you?
And now, she's leading the fight for national standards of care. Although she devotes most waking hours to her cause, Lily still makes time to work directly with patients in the day-to-day struggle with the disease, helping them sort through the pros and cons of their options.
About 50%.
Done this for my girlfriend's health class at Young.
Lily tries to match new patients with women who have had the same diagnosis, like this former client who chose to have a tram,
Above my belly button. Anyway, so that's
a procedure that takes tissue from the waist to reconstruct the breasts.
Yes, that center part
just
is
that
your tummy.
But you can see I have great range of motion. I mean, after
Oh, idea.
Lily
My
even
two
shares the
incisions
results of her
quite
own
different.
mastectomy without
I'll tell you why
reconstruction.
that is. This one was my first one, just smooth, flat chest.
Yeah.
Perfectly smooth, flat chest.
She has 3 sets of different sized breast forms, which she can choose from each day depending on her mood.
Then that one, again, it just depends on my mood.
But the
fear and
biggest
anxiety
decision of all for
getting
Kirsten
higher
is
than
still
the
whether
desire
to remove her healthy breast as well.
Doing something with my other breast. I mean, is that, what do y'all think about that?
In terms of having
It's a step Dr. Nahabedian, her plastic surgeon, doesn't necessarily recommend.
Exceptionally high risk, then I don't routinely advocate getting bilateral mastectomy. You can still have your normal screening, and if you do develop cancer in that breast sometime down the road, then there are still options available to you. So it's mainly if you're...
And even though the risk is only 15%, and I can say, well, gee, that's a pretty low number, she only had a 12% probability over her lifetime of getting breast cancer in the breast that already has it. And a big sigh from the writer here. It is a lot of information. So 15% in her eyes and in her husband sounds like a very large number when she figures that she already got touched at an early age. And I can appreciate her taking that perspective on this.
Well, I want to decide soon also, because when I go home, I'm like, why am I waiting around for so long, you know?
Yeah.
So.
Having been through it herself, Lily understands how hard it is for Kirsten to make a life-altering decision in such a short time. But she knows it will have to be made, and soon. For lung cancer patient Louise Reeves, time is growing short. On each weekly visit, Stephanie has seen Louise grow weaker and weaker. Today, Stephanie has gotten the family together, and tempers are flaring.
Why are you fighting?
My daughter wants to get this where I'm going to be buried, Nat. And he thinks now that she's taking over and all. I don't know.
See, why do you gotta rehash what we just talked
The
about?
lady just
What do
asked
you want
me.
to see? A fist fight, a war, gunfight? What do you want?
Well, she's gonna put me
by cause the fire in the family. I walked in this frickin' place last night. Here's my.
I gotta tell you, I love my job.
You gotta start
But I hate that stuff. I hate the fighting. I hate the bickering. I hate the... Because I know what's gonna happen. I know she will die and Bobby will be guilt-ridden. And then he'll come to me and he'll say something so sad. Why didn't I do this? Or why didn't I listen to my mother? And I keep trying to tell him, just walk away. She starts. She starts it.
No.
Hey,
Do you hear what he's saying?
My case just closed. I'm flying out of
Bobby. So what is the fight over the plot?
Mom has a plot in the veteran cemetery with her husband, Charles. And a few months ago, she had mentioned to me that she wanted to be by her mom. So I called to see if we could do it, and we can.
And that's upsetting Bobby. Why?
Yeah, I guess he just feels, he's afraid that he's not going to get the money.
So Bobby needs money, obviously. So how much money is the insurance policy?
$3,000.
That is not touched. If you're buried in the VA hospital, that's not touched.
She doesn't want to be there. She
I'm in the
wants to
VA.
be at St. Stanislaus.
So that would take the money, the $3,000 that you have saved, right?
Between that and, you know, yeah.
So Bobby, when you go, Bobby, who's been living with you all this time, is not going to have anybody to help him. And he's very scared, not just for you, but for himself. And that's normal.
I know.
Because you'll be in a better place and he's going to be left behind. You have your husband, he doesn't have anybody.
Let him go, he's getting on my nerves. I'm getting my medicine right here. Let me get my medicine. He drives me nuts.
I think I found what the family problem
Not her.
was.
She just said if it's more money
Back door,
towards it, she'd
but
put
I
it.
found it.
She would put it. But she's so worried about the doggone money part. I wished I wouldn't have had nothing and they'd have put me in, what is that, Hooper's Field or?
Louise, that money part. I remember when I first talked to you about Louise, I thought she was hiding a lot behind humor. I knew something was there. I knew that there was a cauldron of anger. Oh, God. Try not to get angry with him because he's just really upset. He's losing his mother and he's losing his home.
I said nothing.
The dynamics in that family are not going to be changed by me. You know, it's hot. Tempers are flying. They're not going to be changed by anybody.
I don't feel good if one thing.
You know, when you thought I was talking to her on the telephone, you weren't supposed to say how sorry you were and all that.
If I can smooth it, even just placate and give her a sense of peace. You know, and this whole world is love, okay? If you don't have love, you don't have anything. And you got it.
Yeah, Lewis has got me all shook up.
You got love. So?
I can't sit in here much longer. I gotta go in.
I know. All right. So love each other, all right? Bobby?
It's day 27 after Liz Dow's bone marrow transplant, and her condition has taken a terrible turn. She's drifting in and out of consciousness and has been placed on a ventilator.
Probably did sustain a bleed around her brain.
Liz's mother and brother get the details from her doctor.
And it was probably because she had low platelets at the time, so her blood was pretty thin at the time. And I know at the moment she's having problems with bleeding from other places, like she obviously has sustained a hemorrhage.
Would that involve, I don't know how to say it, brain damage, mental?
You know, it could do. It's very difficult to say at this moment, but because there's so much else going on, it's very difficult to know what's contributing to what. And so I just don't know. Okay. All right, so we'll touch base with you as time goes on.
Okay. Thank you.
Thank you. It doesn't mean we don't cry, but we're happy because we know where she's, if it happens, we know where she's going.
It's a place that we all leave our baggage behind and nothing but good things.
I think it's just peace.
I think that heaven looks and feels however that we want it to.
I imagine Jesus sitting at the right hand of God and accepting me into his kingdom, and that, hey, listen, I got you now. Everything's going to be just fine. That's what I imagine heaven.
Heaven's got to be an awful large place because there's a lot of good people here.
you know, I take care of so many dying people, and some of them affect me more than others. After Liz died, I was cleaning up her body, and it was nice, the quiet time. It's not a bad part of my job. We take care of the people from the time they walk in until the time they go into a body bag. And I keep thinking, I hear these horror stories from ICU nurses who become very calloused. And there's not really a way you can become calloused on that unit because you're never treating just a body. You're treating Liz, who has 2 dogs and a wonderful friend and a lovely family. And so it meant a lot to me that I could give her the best nursing care that I was able to, right up until the minute when I left her in the morgue.
It doesn't get any easier. You'd think, I've been doing this for almost 5 years. And you think, this time I'm not going to give everything. I'm going to hold back something. And you see these people, you see the love they have for each other and for God and for me.
Police force, he had to work. Oh. And it was just what we had, was just our family there, because the big party.
Sometimes I am so afraid that I give for these patients, and I give my time and my energy and my heart and my soul.
You had to work?
Because it's not just a job. I will cry when she goes, and I will grieve when she goes. And then I'm afraid that I won't have anything left for me.
The little teeny white pills.
And it was like all collapsing in on me, man. I was like losing it, you know.
One of these.
Too much was happening, too fast. Steph walked in, it was like, man, you know, I could take a deep breath.
I take 2 of these. I take 2 of these.
If I need it.
You know, she tells me what's really going on. As you seen, she told me what's up. I'm gonna miss my mom, man. And I'm not really tight with my family anymore, to where we used to be a tight family for some reason unforeseen, I don't know.
That's crazy.
So, you know, when mom goes, it's like, whew, it's a whole new life. It's like starting all over again, you know. I'm gonna miss mom. Man.
Say the receipt for me and I'll turn it into Hopkins and get it back. I need to win the little battles. I need that. I need to have her out of pain. I need to know that her and Bobby, when I left, were laughing a little bit. Because I know I can't win the war.
Okay, dear, let me... So, bye, Jan people says. Bye.
Okay. Can you carry that?
Yeah.
All right, just don't trip.
It is the morning of Kirsten Pickle's surgery. After weeks of soul searching, she's decided on a double mastectomy to remove her healthy breast and all but eliminate any future risk of breast cancer.
I would think that breast cancer would be the worst thing I would ever dream of having happen, but I can't believe I'm able to deal with it. I met somebody who had a mastectomy, and she said that she's a better person because she had cancer. And I think I do feel like I'm getting an experience that, thank God, I'm gonna live through, and it's gonna be something I can hopefully grow from and appreciate life more.
The mission of the surgeon is to transform the woman from a victim into a breast cancer survivor. So she's really having transformation surgery.
Have fun. Do a good job.
Okay, I'm gonna put that right there just for a second.
And she's exchanging her breast for another chance at life, and that is a very fair trade. None of us sign up. Each of us gets drafted into this club. But once we're drafted, If we step back and look at the opportunities that it presents to us, we can learn from it and actually have life after breast cancer. It'd be a whole lot better than the one before, even if the one before was great.
I'm sort of halfway between, well, I mean, Lily seems to be, it's almost like this exclusive lottery ticket that you won, you know? And there's the other side that, oh my God, my beautiful young wife has breast cancer and is having her breast removed and whatnot. But I guess, again, I guess it's both. Anyway, but I'm just wanting to see her and to hold her hand, so.
Because Kirsten has decided to have implants, the operation will take over 5 hours. First, Dr. Dooley removes both breasts. Dr. Nahabedian is there to handle the implants and the cosmetic surgery that follows. At last, the word comes down. Kirsten is in the recovery room, and she's awake.
Wow. I thought I was just dreaming and like a regular night's sleep. And then I woke up and I was like, oh yeah, I think the pain really helped me get in touch with the feeling.
What's happening?
Yeah, because I hadn't hit me.
Well, it needs to hit you. It does. It does, sweetie pie. When it happened, I'm like, why did this happen to me? And did I do something to make it happen? And how can I control this that's happening? But once it was all said and done, I said, I know why this happened. I don't know the cause physiologically, but I know here that it was so I could help people like you who end up wearing my bra later. Yeah.
I'm so glad I came here.
I am too, sweetie. I am too.
It just made me feel better ever since I called you that first day. I mean, it's like, I don't think, I had no way of understanding this and putting it in any kind of place, and it just kind of put it in a place when you talked. There he is.
There he is.
Hey.
I think the reality of all this is now hitting her. Just think about how close this has bonded the two of you. I mean, it was clear you had a good relationship, but look how close this has brought the two of you. That's a wonderful gift. It truly is.
I have to believe in God because I met you. I'm excited. There's so much stuff I want to do.
Absolutely. A lot of living ahead of you. Family ahead of you for the two of you. Yes.
We have such great work.
Plus bagels.
Oh yeah, you're gonna get bagels tomorrow.
Oh,
that's
you have a bagel ahead of you? Oh my goodness.
You mean
Is this
babies?
a special kind? A baby bagel or a...
Yeah. I was like, oh, I want to go after
If I knew that you were going to dinner, I would have made like steak or something.
Oh, my wife probably takes care of Mom, literally.
My job gives me so much. But it takes, I think, a lot of the lightheartedness away from you, not in a bad sense, but that it shows you the finality of life and how each moment, therefore, is precious and not to be taken for granted.
This is a time to reassess what's important in life. Value each day. I mean, there's cliche statements of stop and smell the flowers. I never appreciated that. I was like, well, you know, so what? I don't say that anymore.
You don't have one foot in the grave. You are celebrating life, not embracing death. It is not death. It's joy.